In other news, new coronavirus cases popped up in cities across Australia on Monday, prompting local authorities to impose restrictions in areas not used to living under strict COVID-19 rules. Australia has been broadly successful in containing virus clusters, but is now battling flare-ups in at least 4 cities across the vast continent nation. Take a look.
We are going to be living with COVID for a long time. There will be no eradication of this disease anywhere in the near time, and we need to make sure that we are observing all health advice. We are using all of those mitigation measures that I've spoken to before, but in particular, if you are eligible for a vaccine, please get yourself booked and get vaccinated. I mentioned we will be living with COVID for many years, not just many months and weeks. And I think all of these measures we can expect to see activated and then deactivated as we become more comfortable with the outbreak. But again, what we are trying to do with COVID is protect people's lives and keep people as safe as we can. So, the key metrics here are we managing to do that? And I think we will have to get more comfortable with the idea that there will be ongoing outbreaks in the COVID space, but with all of those mitigation measures, we can hopefully keep people alive, keep people from getting seriously ill, and then as quickly as we can transition back to as normal life as best we can. And vaccination underpins all of that. So again, getting vaccinated, really important to that.
Brisbane, Darwin, Perth and Sydney have all reported new cases of the highly contagious Delta variant, which first emerged in India and has spread in Australia after escaping from hotels used to quarantine returning travelers. The largest outbreak is in Sydney, where 130 people have tested positive for COVID-19 since a driver for an international flight crew was diagnosed in mid-June, with the city's residents now under stay-at-home orders for 2 weeks. A 48-hour lockdown of Darwin and surrounding areas due to end Tuesday was extended to Friday after a cluster linked to an outback gold mine grew to 7 cases. Northern Territory Chief Minister Michael Gunner said that for the first time during the pandemic, there were exposure sites in the city, which is home to a large Indigenous population feared to be more vulnerable to COVID-19. Australia has recorded a total of just over 30,000 cases and 910 deaths in a population of about 25 million since the pandemic began. Officials have been quick to implement restrictions when clusters emerge, almost always after the virus escapes the hotel quarantine system. But the latest measures are among the most widespread since a nationwide lockdown in the early stages of the pandemic.
Back in Asia, Indonesia's